Namaste, I am Dr. Rupashree Dasgupta, a senior gynecologist and gynae oncologist working in Apollo Multispeciality Hospitals, Kolkata. And today we are going to talk about the prevention of one of the cancers in gynecology, that is called the cervical cancer. Generally, people are afraid and very worried if they hear the name cancer. But did you know that cervical cancer is preventable and there is a vaccine available for it? So I will be talking about this today. Now, what is the cervix? Cervix is the neck of the womb. When we have the uterus and this is the uterus, and this is the uterus, and this is the neck of the uterus. So the cancer that arises in the mouth of the womb or the cervix is known as cervical cancer. Now, how is this cancer caused? It is preventable, and that is the good news. It is preventable because it is caused by a virus, and the name of that virus is human papilloma virus. How do we get that infection? We get it through sexual intercourse. People who are very young at their sexual debut or who have multiple partners and who keep getting recurrent infections. So these are the people who need to be aware that this infection, repeated infections over a span of time lasting 10 years can develop into a cancer. But because it is caused by an infection and that to a virus, there is good news that there is a vaccine for it, and this vaccine is not all that costly. So the cervical cancer vaccine can be given to women starting as young as 9 years of age, and from 9 to 15 years, 2 doses will protect you against cervical cancer. And after 15 to 25 years, there are 3 doses available need to be taken, which will again protect you from cervical cancer. Now, those who get the human papilloma virus infection, can they develop the cancer? No, it's not like that. 90% of women with their own immunity will destroy this virus and it doesn't progress into cancer. But in women who have recurrent infections and the infections persist over a period of time, these are the women who need to have a regular checkup with their gynecologist, and at that time we do a test called a smear test. It's called a pap test. So if you are not covered by the vaccine, all is not lost. We still have a microscopic test which we do in the OPD basis, and it is not painful. We just open the lips of the vagina and we take a smear and we look at the microscope and check whether this virus is there or not. We do a DNA testing on that same smear to see if the virus is present or not. And if there is any alteration in the cervix, then it's called a precancerous stage, and we can treat it right then and there, and we can prevent it from developing into a widespread or an invasive cervical cancer. What happens to people who are already diagnosed with cervical cancer? There is still hope. If you are diagnosed with cervical cancer at an early stage, then the initial treatment is surgery followed by chemo and radiation, and the success rate is extremely good. If it is diagnosed at a later stage, then maybe first we need to give a chemo and radiation, and then may or may not need surgery. It can be cured by just radiation mainly, along with chemo in advanced stages. But the take-home message here is cervical cancer is preventable. So when we can prevent something, why go through the pain of getting a disease and the treatment? Prevention is always better than cure. And it is my duty today to teach you about this and to give you this extra knowledge so that you can all be aware that there is a vaccine available. And if you are not vaccinated and you do think that you have persistent vaginal discharge which is a repetitive infective, please show your doctor, and a pap smear done once in 3 years can again protect you. Thank you.